All right, so we are now live, and welcome everyone. Live's Co-Pilot has put together a really exciting panel today that I'm excited about getting everyone to get exposure to the consumer, what's going on. In fact, I was just having a conversation on Facebook with someone who is struggling with home health at the moment with his 90-year-old father. I just invited him, so hopefully he'll show up for this one. So Live's Co-Pilot is bringing you this panel today. We've got people that are professionals in home health and in home care. I know that both of those can kind of get kind of blurry and confusing sometimes, so we're going to hope to help straighten that out. But I just want to introduce everybody real quick. I'll give you all their names, and then we'll kind of go through and let everybody talk here in just a second. So we have Amber Gerard with Home Care Assistance. We have Belinda Schluster with Amada Home Care. We have Beth Edwards with Select Senior Care. Bill Kohler with Griswold Home Care. Greg Williamson with Nurse Next Door. Haley Murray with Comfort Care. Jennifer Chapman with Select Home Care. Keely Moeller with Kindred at Home. Michael Lampkin with Senior Home Companions, and Morgan Van Dyke with Senior Helpers, and Sarah McCord with Bright Star Care. So I'm going to let all you guys introduce yourselves here in just a second. So hang on. Let's just kind of start up here. Hi, Belinda. So you got on. Welcome aboard. So let's just, I'm going to start off. Bill, you're the first one next to me on the screen, so I'll let you introduce yourself. Tell who you are, tell what you do in the business, what your company does, and kind of your scope of services, and we'll go across the whole scope of everybody here quickly.
My name is Bill Kohler with Griswold Home Care. I'm the executive director, which means the buck stops here. We are a non-medical in-home care company. We supply companion care, meal preparation, homemaking, medication reminders. We pair CNAs, certified nursing aides, with people that have needs that exceed what the family can provide, or in some cases what the community can provide. We will go in and augment the staffs in assisted livings and independent livings. Oftentimes, we can keep a couple together in one apartment when maybe the acuity level of one of the husband or the wife exceeds what is normally accepted by a independent living. We can come in and augment that and keep the couple together. We are a national franchise, as are a lot of the panelists. Our corporate office is out of Pennsylvania. It is the oldest franchise in the non-medical home care industry. We will be celebrating, we were the first franchise in Indiana, and we'll be celebrating 9 years later this month at our location.
9 years, that's great. So, well, thank you, Bill. Greg.
Hi, good morning, Jim. Thanks for having me. Appreciate the opportunity to be a part of this.
We're excited to have you. So,
my name is Greg Williamson. I'm the co-owner, along with my wife, of Nurse Next Door Fishers. We are also the first Nurse Next Door franchise in Indiana. I'm a 20-year veteran of healthcare, currently still working full-time at Franciscan Health. And one of my pet peeves being in healthcare is how we just throw around acronyms, and we act like people know what that means. And so I think this is a good and timely discussion, because there is confusion about what is home health and what is home health care. And, you know, in the strictest sense, I guess the definition comes down to what the state tells you the definition is, right? It's a matter of licensure, 2 separate licenses that dictates what you can do. We are currently on the home care side, so not providing nursing care, just like the previous speaker. We're doing the companion care, medication reminders, personal assistance, and so forth. So we have been in business. We have started into our second year and glad to be here. Thanks, Jim.
Thank you. So let's see. Keely, I'll let you go ahead and go next. So,
All right. Thank you again for having me. And I apologize for being in my car right now. I've had to run down a referral, so we all know how that is. But my name is Keely Moeller, and I represent Kindred at Home. And we do home health for skilled needs. So that could be anything from nursing, could be anything, occupational therapy, physical therapy, speech therapy. We also have a home health aide and a social worker. Kindred is actually all over the nation, and we represent the largest home health and hospice provider. And currently I am working on the north side of Indianapolis, is kind of my territory, but we do cover pretty much everything around Indianapolis and a little northeast as well. Other than that, we can provide great care in the home for any type of skill need, medication management, your fall risk patients, your patients that have fallen quite a bit. We have a wonderful program for that. And anyone that maybe has a new diagnosis, a new disease state, COPD, diabetes, just being able to go in and educate those patients, we can do that as well. That is a skill need under Medicare. So, but other than that, that's what I do on a daily basis.
thank you very much. Sarah.
Hello, I am Sarah McCord with Bright Star Care Home Care. We are an in-home care agency, just like some of the others, where we come in and provide private duty services for as little as just a few hours on up through 24-hour care. We have CNAs, home health aides, licensed practical nurses, and registered nurses that provide care in the home. Majority of our clients are going to be, private pay, long-term care insurance, VA, but we also do some different things where we work with a lot of workers' comp injuries. We do pediatric care, and we also work with a lot of national pharmacy accounts doing in-home infusions and that type of service. So kind of a wide variety that we provide, which makes it fun and interesting and a little different every day.
Very cool. Belinda.
Hi, thanks for having me as well. Happy to be here. At Amada Senior Care, we provide in-home private duty care, similar to many who have spoken before me. Our goal is to keep people living safely and independently wherever they call home. It could be in their private home, could be in a community. And at Amada, we're experts in identifying, navigating, and obtaining funding for senior care. So we are experts in long-term care insurance, veterans aid and attendance benefit. We also do reverse mortgages and life insurance conversions. So if people are struggling to find funding for their home care, we can help with that. We file all the claims paperwork and we serve as advocates for the clients. Our care services include medication reminders, bathing, dressing, toileting. So we do the non-medical piece again, which is a great opportunity for home care to partner with home health because they provide the medical piece. And then we also offer advanced technology. We have an online family portal so that the family can stay up to speed on what's going on with the senior in the home. And we have an Amada Connect emergency response system, which includes medical alert pendants, automated medication dispensers, and those types of things. And then we also have a program called Smart Companion, which utilizes Alexa technology for the people who don't or won't wear the pendants. So we have that kind of is an all-encompassing view of the different things that we provide.
Thank you. Morgan.
Welcome.
Hi, everyone. I'm Morgan with Senior Helpers in the Greenwood office. So my owners actually own.
And I always like your name too, so that's just what I feel. But no, I'm sorry.
You like my name?
Yeah, because I'm more.
Oh, I
yeah,
wonder
yeah.
why. Yeah, I like your name too. That's funny. I work for, it is a franchise. We own 5 locations in the state of Indiana. Fort Wayne, South Bend, Greenwood, Bloomington, and Evansville. There are other territories in the area that obviously we work very closely with if it was in a territory that we wouldn't provide care in that zip code. So I do work closely with some of the others that are more local to Indy that I'm sure a lot of you know. They're like family. So we too provide the non-medical care. And really, I think what sets us apart is knowing when to stay in our lane. And we're very aware that we only provide that non-medical care. So it's really important to me to know that whole continuum of care of what a client needs. So I need to know who does what, who does the medical, when someone might need an elder law attorney, that kind of thing. So we really, whether we're taking on the client or not, I need to be a good resource for them. So a lot of people just call us to be a resource anyway. So while we do provide all of those non-medical needs and pendants as well, we really just try to be, a brain for the community of knowing where to go.
Very good. Well, thank you. Beth.
Hi, thanks for having me, Jim. I'm Beth Edwards, and I work for Select Home Health Services. We are a little bit different than the rest of the panel. We are not a franchise. Our team provides the in-home medical or skilled services. We're owned by a physical therapist, an occupational therapist, and a registered nurse, which we get to put people first and business second, which is quite fun. Our coverage area is from about Cicero, Tipton down to Bloomington, Indiana. And then west to east, we cover about Danville, Indiana, over to Shelbyville, Greenfield. Our team does a lot of those in-home rehab needs. We meet the person where they are at home. We have several specialty clinical services. We have a certified wound care nurse, a certified lymphedema therapist, vestibular rehab. We do dementia staging with our speech therapist. And we also have a full-time social worker. So just everything that's covered under Medicare at 100% under a doctor's direction is what our team does at home.
Very good. Thank you. Haley.
Hello. I'll continue the theme. We're in-home care. I'm with Company Care. I should say that first. We also do in-home care. We've been in business for a little over 11 years now. We also do hourly care under the home health license, performing for Medicaid as well. So that kind of sets us apart from some of them as well, is that we can follow the client through the transition of if they're private pay, use all their funds, and they need to transition to Medicaid, we can continue servicing them under with the same aid and everything as well. We do anywhere from 1 hour to 24-hour care. I think our big programs that we specialize in is our Dementia Wise, where we do a special program training our aides and clients and their families over dementia, the different types of it, and the how to deal with it primarily. Some of the characteristics that they'll see in their loved one, and also our Gatewise program, which is our fall prevention. So thanks for having me.
Thanks for coming. Jennifer. You got your sound off. Did you find it? Well, it shows that you're okay. I don't know. Well, I'll let you play with that for a while, and then let's go to Amber real quick.
Hi, everyone. I'm Amber Gerard. I'm with Home Care Assistance. We also provide non-medical or sometimes called private duty home care. We specialize in the north side of Marion County and kind of the rainbow around 465 all the way up to the Westfield area. I'd say our specialty and our passion kind of really lies with dementia and Alzheimer's care and also Parkinson's care. So we provide extra training for all of our caregivers in that, and then work really closely with all of our families who are navigating that diagnosis. So that's us.
And do you teach pugs to like snorkel or whatever? Or so I'm just curious.
I have a pug and I'm obsessed. And our client care manager got me a pug calendar for Christmas. So it makes its debut.
Jennifer, have you got your sound figured out? I don't know. Okay, well, we'll hop in when, if you get your sound going, then yell for us and we'll stop and introduce you here real quick. So basically a lot of what I want to do today is, I think there's a lot of confusion, you know, not to you guys because you're in the thing, but from outsiders looking in, I think that Greg made the comment that we talk in acronyms and, you know, all that kind of stuff, which one of the reasons that Last Copilot has a glossary of terms so you can figure out what the professionals are actually saying. So, but what is the, you know, and all of you can answer this, you know, just and fill in for each other. What's the basic differences between a home care and home health care? Where do those lines cross or not cross? And then I guess we'll start with that. So I'll let you guys fill in how you want to do that. So whoever wants to start. Amber, you're the big one on my screen. So right now your face is bigger to me. So I'll let you go. So
I have a big head. It's fine.
well, it's because you got the big screen. I don't know why. So yeah.
I'm a very visual person. So the best way I've kind of always described it, anything that inserts or exits the body, like a catheter or a feeding tube or a trach, anything that's invasive to the body would go directly to the medical side of things. Anything outside of that is typically all going to fall under non-medical care. So even treating the area or keeping the area around a feeding tube clean, anything hygienic, that can all fall under the non-medical side. But anything that's invasive to the body is typically going to automatically be diverted to home health.
What about meds? That's invasive, but yeah. So how does that work? Yeah, how's that work?
Sure. So each non-medical company can have kind of their own protocols or what they're comfortable with. I know for us, we do not dispense any meds. Anytime it's removed from the pill bottle, it's considered dosing, which would be on the home health side. But anytime that it's already out of the bottle, even if it's taped on the kitchen counter, if it's separated into a pill box, anything like that, then, you know, we can absolutely provide those medication reminders and help them take their medication. We just cannot dose it.
Okay. Anybody like to add on to this?
Yeah, I can say something. So I always explain people or to people the longevity of each side of services. So with the home health side of things, we need a doctor's order, and you might be looking at 6 to 8 weeks of rehab, you know, until you're back on your feet again. And it might be, you know, 1 or 2 hours a few times a week that you can come in. So with the non-medical side of things, I always ask, what are you doing the other 23 hours a day? How are you staying safe? Whether that's with us or with a neighbor or whatever it might be, that falls on the non-medical side of things. So the non-medical can continue for the rest of your life wherever you are living. That's kind of how I explain us. There's no contracted date of time or limit of time.
Another thing that I usually mention, just to give the clarity, is home health is medical. So it usually involves sending in a nurse, a physical therapist, occupational or speech therapist. Non-medical, we're in there doing the basic bathing, dressing, toileting, the things that you don't need a trained medical professional to do, but are really necessary to keep people living safely and independently. Another big difference is the funding. So home health is funded by Medicare, 100%. Home care is somewhat funded by Medicare in a very limited fashion for specific insurance policies, and it's only for certain chronic conditions for a certain period of time. But if you look at funding for non-medical home care, we've got the limited Medicare coverage. Medicaid covers home care as well, and then the other sources that I talked about, long-term care insurance pays for home care, veterans aid and attendance, can do the life insurance conversion as well as the home equity. options for paying for home care. So the funding is very different, and then the medical versus the non-medical.
Jim, I like how Morgan explained it, that the skilled medical side is very specific and very limited by time. And I imagine, like all the panelists, we get into this home health or home care business because of personal experience. That's certainly how I arrived here. And I just remember very distinctly the process of arranging home care for my father, who was disabled. And I'm just reminded of it's an old advertising cliche or adage. People want 1/4-inch holes. They don't want 1/4-inch drill bits. And so how that relates to home care is the care designer was kind of speaking the language of the state that said, well, we can't pass medication, we can't dose medication, but we can give medication reminders. We can't do the bathing for you, but we can assist with bathing. I understand that, but what they failed to get at is really the benefit of those things. And what we're really providing is, as Morgan said, this long-term peace and assurance and safety. And in a lot of ways, the client is the adult children or extended family members. And so, just assistance with bathing. We have this, we want to go a little bit deeper and say, well, the assistance with bathing, the real benefit is because falls are so serious and such serious injuries take place in the bathroom when you're trying to shower or bathe. And that's the value of bathing assistance, safety.
Very good. Anybody else want to weigh in? Or one of the things that I was wanting to, okay, let me do this. So you've got a family, right now that's watching this video either live or they're watching it on a YouTube later or what have you, and they are looking at mom or dad and they're going, gosh, we need care. And I think a lot of people are right. I think a lot of people right now, you tell me if I'm off base here, but I think a lot of people right now are looking at you guys as a way of keeping people aging at home right now, because I know myself, my mom is in a senior living place, my uncle is, and they're on such lockdown that, right now we're discussing having my mom break out for her birthday. Her 83rd birthday is coming up, and so I'm going, okay, do you want to go into a 14-day lockdown? I'm more than happy to spring you, okay, but you're the one that has to live with the consequences, So I know that a lot of people are probably looking at how do they know who to call? As far as home health, home care, how do they know? Is it always a doctor's recommendation, or do they have any other ideas of how they can do that? So I'll let you guys, whoever wants to answer.
Jim, I like to tell people to start with, are they looking at a rehab need? Are they looking to make an improvement in their situation, or more of just stabilize a safety of their situation of where they're at? If they're looking at making functional improvements, so walking better, being stronger, having more endurance, versus just trying to have a safety net to make sure mom or dad doesn't fall, that's going to help determine which way to turn. If you're looking for those improvements and a change in the situation and that component, you're looking more at the home health, the rehab, and that is under a doctor's order. And you start with your doctor there. Or if you know of or want to talk to a home health provider, we can help talk to your doctor for you. So it doesn't always have to start with the doctor. That's something that we're always happy to guide and guide you to the right. Sometimes we're a package deal. Sometimes you need both, because during that rehab process, there's also a safety component where the non-medical care providers can really be of huge benefit throughout that process.
And being in home care, we love partnering with home health because what they do is completely different than what we do. But the two things do need to be a coordinated effort and a partnership. So say PT is coming in through home health, we can assist by having the client do the exercises that they're supposed to be doing until the next PT visit. So it can be a great partnership, and I think it's really beneficial to the clients if we work together on that. And just to clarify, for home care, non-medical home care or private duty, whatever title you want to use, we do not need a doctor's order.
I wanted to add something. I just dealt with this week, actually. A family calling me in crisis mode. We're ready to pull mom out of the facility. We're done. We're ready to see her all the time. And I was kind of like, this is amazing. She still had her own house, but they're doing like an IL-AL situation as a couple, but they still have their home. It's a little special. But initially I was like, whoa, hold on a second, because if we're talking 24-hour care, which we all provide, it's amazing. And, throwing in some home health and different needs in there. Let's make sure that care is in place prior to just, going home and just pulling her out because we're sick of not seeing mom. So really being strategic and I think just calling any one of us, we're all going to get you in the right direction of whatever care that might provide for you. So just having a plan prior to making any rash decisions, I think is always a good start.
Yeah, I was just about to say, you make a perfect point, Morgan. All of us are in this, for personal reasons and because our hearts are massive. And for families who say, I don't know what mom or dad needs. I don't know what my loved ones need, and I don't know the difference. Well, we're in this role because we do know. And so if we're happy, even if I'm not the best fit, even if you don't need home care, I'm happy to point you in the right direction. I think all of us are. So I just tell all families who go, I don't even know where to start. I just say, just make a phone call. And I know everyone here on the screen, if we're not the right fit, we're going to get you to someone who is.
Yeah.
Jim, I just busted my mom out of her assisted living facility.
I remember.
Yeah, you helped with the move. So COVID, it had the effect of, it removed all the reasons why she went there to begin with, which was prepared meals, socialization, activities, and being close to my dad. Well, my dad's passed, and there really wasn't a reason to keep her there. So to your point, what should a family do? Everybody's said it in a variety of really good ways. Start communicating with your family and start asking questions. Just start somewhere with anybody on this panel or another provider. Start asking questions. And for my mom, we just made the decision, look, my sister is retired. She can check on mom on a daily basis. I'll give a plug to In-House Primary Care. They've been terrific for my mom. And then my company, Nurse Next Door, provides a few hours of service. And now mom is living independently and loving it. But it takes lots of communication with your family and a continuum of care, like a checklist. This is what mom needs. Now, who can provide it? And then communication between providers. It's a good place to start.
Yeah, I would also just say, I tell a lot of families similar phone calls that we've had over the last few months where people are wanting to make those moves or transitions. I see both sides. Prior to working in home care, I worked in a community setting, so I see benefits of both, but just not making any rash decisions, really thinking through it, making sure the care is going to be there in place and you can afford it. I mean, that's another thing you want to look at all aspects, what's being covered in the community setting with food, electricity, care needs, all of that, maintenance, housekeeping. Those are all things you have to take into consideration if you are going to do a different type of living situation. So great for some people that they still have homes that they can transition back to or go live with a family member, a child, but some don't and need to figure out a different housing situation. And so just looking at all of those options, cost, care needs, and making sure that everything's in place before you make a quick hurried emergency, because I know we've all gotten those emergency calls too, where it's like, I need care, you know, as of 3 hours ago kind of thing. So just doing that proper planning on the front end is very important.
Well, you know, this is what all of you guys do is help people, you know, age at home or what have you, or stay in maybe independent living longer, or maybe stay in an assisted living longer, you know, as they may go through a decline, but you guys can kind of prop them up. I guess one of the questions I'm going to have is, and things that I hear people say, okay, you know, now a lot of times when people, I'll have people give me a hard time because, well, I would never put my mom in an assisted living, or I never do. And I'm going, well, when you get to the point that you have that conversation, then come back and talk to me. You know, let's, you know, it's like, it's real easy to say what you would or wouldn't do when you don't know what you're talking about. Okay. But, what I would say is this, I would imagine that you run into a lot of people that are feeling guilty about them not doing all the work, and they're offloading some of the work to a professional to do this, and we're bringing a stranger into our home. You know, how do you calm that family's concerns on such things? And it's for both care, you know, both home health and home, you know, care.
Hey, Jim, it's Keely here. I'll take that one. I think
Okay.
a lot of, we do hear that, at least on our intake team. So in our operations side, they're the ones running the referrals, talking to the patients. They do get a lot of feedback and kind of kickback as I don't want someone in my home, or I don't need this assistance, or whatever it may be. But so we have to have kind of salespeople, kind of sort of say, in-house too. And sometimes it takes 2 or 3 calls to the patient or to the family. Most importantly, I think we have to reach out to the family, because then the family can go back and speak to their mom or their dad or whoever it might be that they're trying to get help for. But it's a lot of encouragement on our end, and just letting them know what we're going to do. And I know with really not so much anymore, but I was able to go into the hospital systems, or able to go into assisted livings or skilled nursing facilities and really talk to the patient before they would go home, to kind of ease their stress, ease their anxiety. Obviously don't do that anymore with COVID. So that's really the part of our intake team, just to talk to family members. And it could be 2 or 3 or 4 times before we finally get them on board. But it's just a lot of helping with their anxiety and coaching and just educating, really.
Yeah, Jim, you're hitting the nail on the head for part of our assessment right here. Burden of care is actually part of our, what we track and what we observe when we go into someone's home. And sometimes we have to have those tough conversations. Statistically, if it's a spouse that's the caregiver, they could potentially go before the actual client themselves just based on stress alone. So by bringing someone like senior helpers or anyone else in for a few hours, even just so the wife can go to the store or go get her nails done and just have quality of life herself, it's a huge benefit and peace of mind.
Yeah, very well said, Morgan, because if the caregiver gets run down and gets sick and dies, then there's nobody to help the original client anyway, and it's just a losing situation.
And I
And
think
a lot of times they keep trying, you know, and keep going out of pride or obligation, but you can't take care of someone else if you don't take care of yourself.
Mm-hmm.
And to
often,
I think, sorry, Sarah.
No, go ahead.
But to piggyback on that, we do a lot of coaching, like Keely said, of helping people understand that our goal, all of the panelists and their companies, is to keep people at home wherever they call home. So, you know, we're not in there to change their living situation. We're only there to help improve it and meet their goals. So if their goals are to stay at their residence and not move to an assisted living or a nursing facility, our team wants to find out what puts you at risk for moving to a different level and put things in place to help you not do that. So whether it's building up strength or showing you where you can put a grab bar or, helping you figure out what hours of the day a caregiver would be the most beneficial to reduce your risk of falls. Those are the things that our team is in there to do, whether that's under the rehab at home, the home health umbrella, or under the home care umbrella.
I think sometimes too, it's helping families think a little bit outside of the box. So what I mean by that is we all get those phone calls where they are a little resistant, right, to having someone come into the home. Makes them nervous. They think they don't need care. They're doing just fine. That's what they're telling their children, who obviously see different and know different. So just to give an example, I had a couple, husband and wife, who the husband has Parkinson's. He's the one that actually needs the physical care. His wife was still doing all of it and can do all of it, but she's exhausted. And he was 100% resistant to having any in-home care services. He wasn't going to do it. He was not going to have anyone assist him. She was the only one that he would allow to assist. Well, we had the conversation with the family. She's going to ultimately end up in the hospital or something worse because of what she's doing for him and caring for him, plus all the regular household activities and all of that. So with him being resistant, she wasn't. So we ended up bringing her on as the client. Even though she didn't need any hands-on care, we came in and do the laundry and the vacuuming and the grocery store trips and, taking the trash out, just things like that she was still doing on a daily basis or a weekly basis that were making her even more exhausted and taking care of him. So by bringing her on as the client, it freed her up from some of her daily chores and tasks that she was doing to not be so tired and taking care of him. So we're all good at figuring out how we can make this work for different families when somebody is resistant or thinks they don't need help, kind of thing. So.
I love that. That's definitely out of a lot of sense. That's a good one. I'm trying to think of how I want to ask this next question. I know what I want to say, but I'm trying to figure out how to do it. But anyway, I know. Okay, let me go this way. Amber, you are the first one that said this to me about 1.5 years ago, and I just thought it stuck. So it stuck in my head. Was when you're having conversations with the client that's being resistant, where you talked about that let someone else come in and change the sheets and wash the sheets and fix dinner or whatever, and you sit down and actually be the spouse or whatever. So I'll let you kind of go back into that, but that was, I love that imagery.
Sure. So a lot of times, and we've all seen it, the relationship between a spouse and their loved one or a child and their parents, it changes as their care needs increase. And a lot of times family and friends can feel, I hate using the word burdened because they want to do it out of love, but suddenly the relationship is about, okay, I need to get to mom and dad so that there's dinner on the table at 6. And then afterwards I need to make sure that I clean the bathroom and make sure that we've got, all the laundry done, and their relationship changes and it becomes more action-oriented and chore-based. And I always said, if a lot of times that is the stressor, right? They miss their dad, they miss their mom, they miss their, their spouse and that quality time that they get to spend with them. So having someone come in and kind of alleviate some of those things, like Sarah was saying, let us come in and do the laundry. Let us come in and make sure that the bathroom is clean. So that when you come over for dinner, you're not cooking and cleaning and making lists for grocery shopping. You get to sit down with your loved ones and have quality time with them. And it just changes the relationship. And, there's always a fear base there too, that something's going to happen to your loved one and we need to embrace all the time that we have with them. So you kind of get some comfort knowing that I got to spend quality time with my loved ones, and it wasn't so much about running the household and making sure that everything was taken care of, but about, you know, quality conversations and just time with them. So the relationship just kind of gets to change back to, I think, what we all want. So
I've never
Jim.
said that. I liked it. So go ahead.
Well, I just think that we all have to be counselors at time.
well, yeah.
And people, adult children and spouses, they make these promises. I will never put you in a nursing home. I will always be your caregiver. And sometimes we have to ask them to kind of take a step back and get back to, why did you make that promise? What was the motivation? Well, it was because it was out of love, because you want to make sure that your loved one is comfortable and pain-free and has the best life possible. So you get them to step back from that and to accept help and to accept someone in the home. You can help them see that, okay, I'm not breaking my promise. I am fulfilling it in a different way. And this is really the best way to provide the loving support for my husband or my wife or my parents. So it's just kind of getting them to think differently about those promises. And it's okay. You don't have to feel guilty. You're not breaking a promise. You're fulfilling it in a different way.
You know, I know when I took the Dementia Friends class, and one of the things that they talked about in there that was very eye-opening. And I was having a conversation with someone the other day, and this about, we actually were on one of these kind of Zoom panels, and this particular individual has not been in the senior world that much. And so he, you know, in his mind, his wife, you know, was the only one that was ever going to take care of him if he got old and needed the help, right? And hearing this next thing was such a eye-opener to him. It literally changed his entire perspective, was that the 67% of caregivers end up passing away before the person they're caring for, because of all that nonstop 24/7 stress.
Mm-hmm.
You know, and so, I mean, and I think that when you're in those kind of roles, you get to where you don't even think of the loving relationship anymore, because you're just under all this stress and these chores of trying to get things done. So I don't know if you guys, you know,
Mm-hmm.
found that or as well in that world, and helping people see that light at the end of the tunnel. So
Yeah, you tend to go into autopilot and when you get to that level of stress. And I think partly why the main caregiver can kind of decline first is because of the impact that stress has on our body. You know, it affects our appetite, it affects our sleep, it affects our brain function. So yeah, any way that we can help both loved ones thrive, I think that's kind of our big hope.
Where you really see it is when that caregiver is not getting any sleep. They're getting up multiple times during the night for whatever reason, to change a brief, help someone to the bathroom, give a medication. I mean, the list goes on forever, but they're not getting any quality sleep. And then when they're awake, they're doing all these tasks all day long, and there's just no time for their body to physically recover. And that's on top of all the stress of it. That's what I find. I mean, the nighttime, the lack of sleep is huge, in addition to the stress.
I think too.
Go ahead. I'm sorry.
No, I was just gonna say, I don't know about you guys, but I can assume it's probably the same. We're getting more and more phone calls from younger folks. I would say people that are around my age, actually, that I talk to frequently, who are what I call the sandwich generation. So they have young kids at home, and they also have aging parents that are needing more attention, and they're pulled multiple directions, and they don't know what to do or how to help, and they want to be there for their parents, but they also understand that their first priority is going to be their kids, and they've got to be there for them. So so they're asking for help. But in talking with a few of my just personal friends in situations that have been in that same scenario, it's come up a few times where they are dealing with their own emotional grief after the fact, after a parent has passed, because they're looking back on those last few months or years and realizing that they were resentful of their parents and the time that they were having to spend, and they weren't able to be the child because they were, like Amber said, doing grocery lists and, you know, laundry and all these things when they were visiting. And so the last memories that they're having are not good and not what they wanted them to be. So if I could tell anyone that's, you know, that I know personally and that we get in these conversations, it's, you know, ask for help before it's too late. So that way, when you look back after your parent has passed, that you don't have these feelings and memories that just bring up not great feelings for you or emotions for you. So if you can ask for the help and you can get that in there, whether it's through an agency or it's just through church or pulling together neighbors, you know, whatever it is, ask for the help, because you want to be able to look back on that time frame and have fond memories of spending that time with your parents.
I think I say that about once a day. Let's be proactive instead of reactive. At least get the information now. Call us in a year or two if you need to. Like, we're going to be here. So I find myself saying that all the time.
Very well said, Sarah.
Mm-hmm.
When my in-laws were first going through this whole place, we were the poster children for the sandwich generation, and, you know, and they were an hour and a half away, and all these different things. We had kids in travel sports, and my wife was literally coming apart at the seams, you know, trying to, you know, to be all things to all people at all times, you know. So it's, you know, at that time we weren't even aware that there was resources like this out there, you know. So it was, you know, and but I understand that stress level that comes with it, and you end up becoming more of an employee than a family member, you know, in that whole process, you know. So one of the things that Sarah, you brought up that I think makes, you know, is a really good point is I also, going back to Dementia Friends, I learned that 1 in 6 millennials is a full-time caregiver to a elder family member. Okay.
Right.
And in fact, 1 in 3 households have someone that's doing care for someone in that household that needs care. So this is a huge issue, you know, and the millennials, for instance, 1 in 6, that's 12 million. That's a lot of people that are in that situation. And I'm not sure that's one of the reasons Life Co-Pilots out here, we're doing a lot of digital stuff. We're trying to, because who's talking to them? Who's helping support them? You know, how are your companies doing outreaches towards that part of the marketplace?
I think it's important too to not overlook asking why. So we see people decline, we see them have a change and need a change in their situation, but a lot of people just want to throw the Band-Aid at, okay, I need caregivers, I need to get someone to make sure mom and dad stay safe. Yes, absolutely you do. But don't forget to ask why. Why is this change? It doesn't necessarily have to just be old age. You know, I don't think that's a thing. I know people age and they tend to decline, but there is no exact timeline of when people are quote unquote old age anymore. If they're taking care of their health. So really getting to the medical professionals as well to really dive down. Why is dad falling 3 times a week? You know, is there therapy that can be put in place? Is there something in his situation? Maybe it's blood pressure driven, maybe it's medication driven. It doesn't just have to be because he's aging. So I think that's important too, is there a rehab solution to either slow down the progression of the problem or even reverse in some situations that problem? And that's where the home health, the medical can come in play.
That's exactly what I was going to say. I learned that maybe, I don't know, a year ago. So not that long ago, what to really look for to differentiate. So yeah, why is he having a fall? You know, it can explain a lot more just by bringing in home health. And even when someone has a med change, it's okay to bring in home health, you know, just based on education alone. So for me, on the non-medical side of things, it was very eye-opening to know, oh, it didn't have to be straight out of rehab, or it didn't have to be because someone broke something. You know, it can be like the most minor change, but just to get them back on their feet and learn how to use whatever's new.
Very good. Bill and Haley, I want to call you guys on something because I heard you say something both early on. And Bill, I think you said you've been doing this 10 years, Haley for 11. That's, I think, the longest of any of us in this particular space. So tell me, what have you seen change over the years? Because people may have had their own interpretation or what their own belief was because of something that's happened in the past. Could you tell us, kind of bring us up to date on what you've seen changed in the industry?
Personally, I would say 99% of the people I've met in this business are in it for the right reasons. I know we all refer to one another. I mean, when our basket's full, or when, in our case, a lot of times when somebody has Medicaid money, we don't participate in that arena. So we're more than willing to direct them to somebody we know that are going to take care of the people. I think from a community standpoint, the biggest thing I've seen change is the palaces that have been built in the last 5, 6, 7 years. And the decision makers might be from 40 to 50 years old, and they see a wine bar, a billiard table, marble floors, and they go, oh boy, I could live here. Well, what they don't ask for is the ratio of staff to resident. They don't ask to see the state complaints, which have to be shown. If they're asked, they have to produce them, and most communities have them right in a common area. And I think it's through webinars like this to spread the word, to educate the decision makers. And I'd say, you know, I've seen people come into this business and the 1% don't make it 2 years. There's a lot of competition out there and everybody's doing a good job. And so, you know, in my way of thinking, that's great. But I really, before somebody places somebody in a community, I wish they would, you know, be taught to ask the right questions. Because there's a lot of communities out there doing great work too. I'm not bashing them. I'm just saying that, you know, it goes deeper than the surface. That's what I've seen change a little bit.
Thanks, Bill.
Yeah, I would, gosh, what's changed? I think, and the biggest thing that I noticed in changing is, it's kind of funny, it does go back to a lot of the communities. Like, I feel like in home care, there's a lot of owner involvement. And the one, you know, and so you know who to go to with that. And with these communities, oh my gosh, the people in and out of them change so quickly, and it can really affect the care. So like when we first started, there would be these communities that were like the go-to, the top ones. 3 years later, it's a whole new staff, and people, they don't have residents anymore because their care is no longer there. And so I think that's been a huge change in just in like the roller coaster of what the healthcare world goes through even. I mean, it happens in home health and hospice and home care as well, to where it may be a great 5 years ago, but then today all of a sudden you're like, what happened to this company? So it's not necessarily the same as what your grandma went through. So I think getting educated is huge on that. I do think also what I've seen change is the internet. The internet now is a huge resource where people go to get their information. And, you know, 10 years ago, I didn't have a smartphone to run a business. You know, I had like a flip phone. And I mean, just think of how archaic that sounds now. Like, and I was like, well, how did the owner even start when cell phones weren't invented? Like, it just blew my mind that they could run a home care without a cell phone at the time. And now I'm like, how do you run a home care without an iPhone, like, or an iPad? So just seeing how all of that's changed too, and that, you know, you're putting more focus into SEO and all of that stuff as well. I guess that's more of like business changes. Obviously, you know, our clients, I see both. We still have our sweet old healthy 99-year-old ladies that are doing great, but we have seen a lot younger people too, because we live in an unhealthy country, unfortunately, for a lot of people too. So I think our age of clients is changing too.
Now, one of the things that I was going to say too is, you guys, all of you, I think, and correct me if I'm wrong, but don't you guys also go into, if someone's living independent living or if they're living in assisted living, you go in there to augment the care and support them in that. With, you know, I know that you do that. With COVID, how is that working? Are you being allowed in, or some say yes, some say no? How's that working for you guys? You know, whoever wants to go.
I can speak. Oh, sorry.
Yeah.
I think it depends on the facility. When COVID was hot and heavy, I would say 95% of them were like, whoa, no, we can't have anyone right now. Unless the family threw a big fit, then we maybe got an exception. But it's definitely starting to loosen up, I think. I think they're starting to see the precautions that need to be taken. And yes, we're able to get back in more so. Obviously, temperatures are taken. We're doing all of the masking and gloves and stuff, but I think facilities are okay now with aides coming in from our standpoint.
And from the medical side, we've seen that as well, that initially it was all doors closed. We need to just keep everyone separated. But I think we've learned enough about the virus over time, and there's substantial protective equipment to go around now. And I think communities have learned the risk versus the benefit. You know, with the right trained providers following all of the protective isolation and infection control measures, it's so much easier now to be safe in providing care. And the benefit of the care actually outweighs the risk of the virus being spread in communities now.
Yeah, and I think it was I felt horrible for people in facilities right then that did have our services and then had to stop. They obviously had our services for a reason. They needed extra help because the facilities couldn't staff them. COVID comes, facilities are getting shorter staff there, and our clients aren't getting the extra care that they needed. So I know, I just think it was very unfortunate, the whole situation, obviously. So hopefully it's starting to get back to where people are getting the care they need.
Well, I've got one woman she is a nurse advocate and rent-a-daughter both. So she does both home care and home health care. And she is actually for my mom and for my uncle, and she's been shut out of those facilities since March. And so my uncle was actually running into some decline because of the isolation. And so we ended up in the hospital. It's kind of weird that we can see him in the hospital easier than we can see him in a care, facility. But basically went back to the community and said, we really would like to have our eyes and ears in there, and then go, this is a professional who she's, and so she's back in with him a couple times a week. And now I'm starting to use that as leverage for the other place but I mean, I just didn't know what you guys were running into, but I know myself, as a family member, I feel much better knowing someone that's been with us for a long time giving us that data, so.
We had a few facilities tell us in the beginning that the only way you were allowed in was if you had physician's orders, which is generally for the home health side of it. So I went and got physician's orders from their doctors that said that they needed a bath, 4 times a week or whatever for their own health. And the facility couldn't provide it, and I knew they couldn't. So they allowed us to come in. So just a couple different scenarios where I'm like, well, I will find a workaround for this to make it happen. And then I've noticed just in the last few weeks, some of the communities we work in are now requiring negative COVID tests to be done every week or every 14 days and showing the results of those for the caregivers that are coming in. Or even putting limits on how many other clients that caregiver can see within a time frame. That was a new one for me yesterday, actually. I hadn't experienced that yet. So, it's just like Haley said, it depends on the community and how much you just stay with it, and they'll see. I mean, they've seen that the benefit outweighs the risk. So
a decline that I've not only heard about, but like seen with our own clients and just big picture of seniors in general in isolation. I mean, the mental health of this country is not good anyway. And then you throw dementia in there and then all this isolation. It's going to be interesting to see where this goes at, even, you know, post-COVID, just with the mental decline. It's been really discouraging. Yeah.
I know for
and so,
us, oh, sorry.
no, you're fine. Go ahead. You're okay.
I was gonna say, I know for us, we had to get creative, especially in March and April, with how we supported different communities and facilities. You know, we know that they're doing a lot of the physical tasks that need to be done, the bathing, you know, toilet assisting, all of that. So we had to get creative with how can we kind of go in and support on the mental health side and the mental stimulation. And so we would put together different activity things. You know, they're suddenly locked in their room and they can't have dinner with the rest of the men and women in their pod or whatever. So we had to get a little creative on how we can help with the mental health side of stuff and the mental stimulation side of things. I don't think any of us let up, certainly during COVID, even when we couldn't get into the buildings to see our clients or our patients. We just had to get creative, so.
And obviously the skilled nursing is more restrictive than AL and IL. And one thing that I think was frustrating to the families was that we could get in, but they couldn't. So we did have to serve, and we still do serve as the eyes and ears for the families. So thank goodness we're able to do that for them.
Well, I can't believe we're coming to this time already, but before we do, there's one question I ask on every one of my panels, okay, because I love the answers that come from it. And I'm not going to pick on you. Any of you go and all of you go if you want. But you have an audience right now. I don't know how many people are watching us. We'll have no idea. But if there's something that you would like to be able to, you've always wanted to get up and scream from the rooftops and go, people, pay attention to this. Here's your time. So take off. Anybody got something that's burning?
Yeah,
Yeah, sorry, go ahead.
No, I mean, I will just say, I know we talked about it a little bit, but I'm always a huge advocate for families to think about, this is not a time to, you know, be unselfish. You have to think about yourself too, and your family and your well-being. And a lot of times that does mean, you know, getting help that maybe mom and dad are resistant to, but you still have to do it. Like, you just cannot put yourself on the back burner all the time, because you're going to end up being the one that's just burnout and tired, resentful, whatever. So it's like, start with baby steps, do a couple hours a week or whatnot, and then expand from there.
Yeah, I think my big thing too is just telling people that you're not alone, that millions of families are going through this, and that, you know, it may look like Susie, your neighbor, is a rock star because she's raising 3 kids and taking care of her parents and, you know, handling it better than you are, but she may have additional resources that you're not aware of. So it certainly can be a very isolating and lonely experience to be a caregiver, but knowing that you're not alone and that there are other people in the same situation, I think can be a little comforting. So yeah, just, you know, and piggybacking off of Haley, you know, time to be a little selfish and take care of yourself too, so.
And on a different token, know that you have choice, that it's the best for you to take the time, even if you are in a time crunch. It's completely possible to interview providers. If they can't talk to you in less than a 24-hour span and they're not meeting your needs, maybe that's not the provider for you. So really take the time to match the provider that's going to meet you where you're at and meet your needs. So interviewing providers, asking for family and friend recommendations, and asking hard questions of why they recommend that provider, so that you make sure that why they recommend meets your needs. Just because maybe your doctor says, I like using this company, that might be all great, but does that company do what you need them to do and meet your needs? So please know that you have choice in every situation. It's your Medicare given right, and take the time to find the company that's going to meet your needs.
And don't wait too long to get care. I mean, I'm thinking back to the story that Sarah told. You know, don't work yourself to death when those are the precious moments that you'll have, last moments that you'll have for your cherished memories. Have someone come in and help. You'll feel better. Everyone will feel better. A lot of times people say to me, oh, I wish I would have done this sooner, even if they had initially been resistant. So give it a try. You can do it, as somebody said, take baby steps, but think about the well-being of the whole family unit, including the client, the caregiver, and all the extended family members.
I think we touched on it earlier, but just picking up the phone and calling just to inquire, and calling any one of us, we're going to steer you in the right direction. But just making that, I know I put things off when I'm trying to call for my own well-being, but just making that initial phone call, you'll find that pieces will start to fall into place.
And asking, making those phone calls, but even if you don't know where to start with that, you may not know someone like us on the panel that work in this industry, but ask your neighbors, ask your friends, ask the people you go to church with, because they will. It may not be something that comes up in just normal conversation, but if you ask the questions, or do you happen to know anyone that helps or works in senior care or could help with my dad who has Parkinson's? I mean, just saying something simple like that to your current network that you have around you, you will be surprised how many people they can connect you with. I have a neighbor that connects me with people all the time that she's talking to, because she's like, well, I don't know, but my friend Sarah does, and she will send people my way. So just ask. Even if you don't know, one of us or someone in the industry, the people around you are a support system, and they will point you in the right direction. It's just like they teach you in the Dementia Friends class. If you bring up dementia and Alzheimer's, you'd be shocked how many people respond back because they've been in this situation. They know someone, they've had a loved one. It's the same thing. Just put the question out there to your network, and you will get to the right people.
Yeah, I can't improve upon the answers. Just encourage people to be their own fierce advocate and to be bold. And it doesn't matter how many initials or degrees we have. You as the client, you're the expert for either your own care or for your loved one, if they're a little bit perhaps dementia. You're the fierce advocate, and the cliche, there's no bad question or there's no dumb question. I think it was Beth that said, ask the why behind what people are proposing. Well, why would you do that? Why do you recommend that? What's the purpose? What's the expected outcome? You're going to have to be bold and be confident in your asking questions.
Anybody else? Jennifer, I just see that you actually have been there. I lost you. Can you speak yet?
Jim, I have no idea what has occurred. I've listened the entire hour, but I don't know why I haven't been able to speak the entire hour.
Oh,
in the world.
Say something.
Welcome. Thanks for having me.
You were sitting there, we couldn't hear you, so.
I'm so sorry.
So
yeah, no, I guess
you are and what your company does.
Yeah, too. Oh my gosh, 1 minute. Yeah, so I'm with Select Senior Care. I am Beth Edwards' counterpart. So it is nice to have both the medical and non-medical available in one company. And it's always great when we're able to work together for the same client, just because the communication is so on point. Everybody's in the loop. We don't have to, obviously. We work with a variety of other facilities and partnerships and things, but it is nice to have both in one company. So yeah, I'm the Director of Client Services for Senior Care. We do offer a 1 hour minimum up to 24 hours. And we are able to take med waiver now, as well as VA and long-term care and private pay, obviously. But I do want to mention the nice thing that we're able to do from an accountability standpoint. When I'm able to talk to families and they're asking like, well, how reliable are you? And from an accountability standpoint, we've got a really good finger on the pulse with our caregivers, and we're always going to know when they're supposed to be at a client at, let's say, 8 a.m. We're going to know by 8:10 if they're not, because it's on their app, and so we'll get that push notification if they haven't checked in, because they can't check in unless they're physically on the premises. So there's really no hiding it or lying to us. We're going to know if you're there or not, and we're then able to call you and say, hey, are you on your way? Are you late? Or is something wrong and you're not able to make it? That way we can then notify the families or the facilities and say, hey, we're aware so-and-so's not there. We're looking to backfill that right now for you. So complete transparency and accountability when it comes to our caregivers. So thanks for having me.
Well, thank you. I just want to make sure you got a chance to get introduced, because you got stuck in the hold there for a long time. So let me do. I mean, we've gone long, which is so easy. I think we could get 2 hours out of this one and still not really, backtrack over the same ground. But I want to do a screen share real quick if I can get my thing to do this. So I want to show you guys real quick. One of the things, a lot of the things we're talking about is getting people to understand what's out there, getting people to understand how to find information about senior care and all the different areas of it. That's what Life Co-Pilot's all about. We have all kinds of resources here that you can go into, and there's a place in here to find out what an ADL is, or an IL or whatever. Right now for some reason my internet doesn't want to go, but I got the beach ball thing going here. Okay, so there's like all the different things that are pull downs of information. There's blogs. Many of the people on this panel have written blogs on here, so you can go and pick their brains in other resources. I wanted to show you events. There's a place you can always be in here looking for what's going on. We do at least 2 of these panels a month. And so, like, for instance, today we did the difference between home care and home health care. And then on the 19th, drum roll please, we are going to be live and in person, sitting in chairs, all in the same room, all the same place at the same time at the Westfield Library, doing what senior living is today. And it's not, and this has come up about the Taj Mahals and things like that, what's going on with that. We're going to be covering that on the 19th. On the 27th, we have a support for family caregivers through adult day and respite care. On the 29th, one of our Shepherd Center of Hamilton County is one of our members on Life's Co-Pilot, and they are doing a virtual trivia event. So anyway, I just wanted to kind of give you a quick view of that. You can always go in and learn more about what's going on there. So guys, thank you so much for coming. We will be putting this is on our Life's Co-Pilot Facebook page. It is on our Life. It will be put on our video library of our Life's Co-Pilot website. And additionally, I'll be giving each of you a copy of the YouTube to do with as you please. Thank you for coming. Thank you for sharing with us. Thank you for anybody that's watching. And we will talk to you all later. See you all. Thank you.
Thank you. Thanks.